during that year I was going through it, I was so depressed and frustrated. Like, I was not in a good place. Like, it was a hard year.
Hi, I'm Sabrina, a licensed massage therapist and certified cosmetic surgery specialist. And this is Talk Plastic Surgery, where we talk about the good, the bad, and the ugly, which is what this patient went through. Some pretty ugly stuff that lasted over a year. So, without further ado, please welcome my guest, the Shroom Anonymous.
Oh my God.
And if you're only listening and not watching on YouTube, we are dressed like mushrooms because now when you come on the show anonymously, you gotta dress like a mushroom. Stay tuned for the shroom booty. But anywho, thank you for coming on the show.
Of course. Thanks for having me.
So what procedure did you have done? What was the first procedure that you had done?
Well, multiple. That first surgery was tummy tuck, 360 lipo, fat transfer to the breast, and CO2 laser to my face.
Wow. And so when you were deciding on having the surgery, what made you decide to go and have the surgery?
I had multiple children, so it was working out quite a bit, and it's just that laxity in the skin that was never gonna go away. Yeah, and I wanted to look like I was actually working out, so um that's what kind of started it. And then the CO2 laser, I think that just got thrown in at the end because I was gonna be under anesthesia, and why not?
Did he offer that to you in the initial like consultation or was that like kind of spur of the moment?
No, I think that was for like I do laser stuff throughout the year just for, like hyperpigmentation and redness and things like that. So this was just something I had heard about the CO2 laser. I had heard it was pretty like invasive, and I'm like, well, if I'm already going to be taking time off of work and not being, not showing my face to anybody, I might as well just throw that in there. So that's why I did that.
So, what made you decide to go with the surgeon that you went with the first one?
So I had interviewed and met with probably 3 different surgeons that I had basically just gone on to like Google and looked at Yelp reviews. This particular one that I went with had a lot of great Yelp reviews. Um, and so I also knew somebody, I wouldn't say like a close friend, but more of like a mutual acquaintance that worked in his office. So there was a personal connection there. So I think that's kind of like, she kind of made me feel comfortable making the decision and going with that doctor. Got me some other discounts. So that was like kind of a factor too, was financially. So yeah, so that's why I went with him ultimately.
Wow. So now, what was your experience with this surgeon and this procedure?
It was not good. Let's just start there. Yeah. Initially, like just right off the bat, like I think within three weeks or so is when I started seeing you, and like I had a seroma, like right off the bat, like you were the one who actually told me, I think that's a seroma, and I'm like, what? And so I went back to him for that, where it was drained weekly for weeks. And then it seemed to go away. Um, so then that was kind of taken care of, I thought. And from there, I think it was about 3 months later, it was on the 4th of July, actually. I ended up having pain in my breast. Yeah. And so ended up with,
Fat transfer was, right?
yeah, that's where the fat transfer was. So I ended up having to go to the emergency room. It turned into like I was running 104 fever for multiple days. So I went to the emergency room, and they told me it was like likely a breast infection. They tried to drain it, put me on antibiotics. That turned into, I think, 3 or 4 trips to the ER urgent cares, multiple antibiotics. Like this is all over like a month-long period. Yeah. I finally got into Sunrise Hospital to have an ultrasound and a mammogram done, and it was basically an infection, to like a huge infection that had encapsulated
And turned to like an abscess.
an
right?
abscess, and it was quite large. So they said the only way, basically, the antibiotics aren't going to help this. So you're going to have to go with a breast surgeon. You're going to have to find a breast surgeon in Las Vegas who can actually go in and drain this and take this out.
Oh my
So
gosh.
that was not expected. I did not tell them that any of this had to do with the fat transfer. So, because I knew my insurance probably wouldn't cover it if they knew it was cosmetic related.
Yeah, 100%.
So, I ended up just like, it was like a random infection. And so I ended up finding a surgeon. Luckily, I knew a doctor who helps me get in because these breast surgeons in Vegas, most of them are oncology breast surgeons. And it's not easy to, I think there was 3 at the time. One was out of maternity leave. And so your options are limited. Damn. But I ended up finding a good one, and she was about to go on vacation for like 2 weeks, and she said she'd do the surgery. So I ended up having to go under anesthesia again and have it drained and removed. And then I had to have a drain in again.
At this point, are you like, what, 6 months now?
This about 3 months. Yeah, because my surgery was in March.
Oh,
So 3 or 4 months. Yeah, this is in July.
So how long from you going to Sunrise, them finding the abscess, and then going back in for surgery? How long did that take?
Total of a month.
Oh,
So
wow.
actually, and that was like
Dealing with all that.
yeah, and being sick and running a fever, and not being able to work for a month straight. Oh my gosh, so that was pretty. Yeah, I just remember being miserable, and yeah, thank goodness this breast surgeon was able to take care of it. So I got that taken care of, and then I think it was
How was that recovery, by the way?
I had to have the drain in again, which I had to have due to the lipo previously after my first surgery. So yes, it's just annoying. You can't lay on it. You have to kind of sleep on your back. It's just having a drain.
And just one boob.
And on one,
They had it inside one boob.
and then they're not even. So, one is fuller than the other because the other one, she basically took out some of that fat transfer that was done. So that also stinks, but I'm not going to do it again. So, yeah.
Never again. And that's the ugly.
Yeah,
That's the ugly.
For real.
So with did you ever tell your surgeon what happened?
no, not that breast surgeon, because I was not taking the chance that this was going to get billed to my, not get
So
Billed to my
insurance covered
insurance.
it.
Yeah.
Insurance covered
all of it. Thank those.
Love
for
it.
that. Thank goodness.
Or else this procedure and multiple surgeries that happened. That was one of 2 surgeries that happened.
You had to have 2.
Weeks after. Yeah.
What
Then
was the second one?
the second one was, I think it was about December of that year. So now we're like, even further down the road. And I had gone back to weight training, which is something that I like to do. And I just started noticing swelling. And so I don't know if this was this original seroma that was never fully healed, or if I did anything by weight training to create something else when I wasn't fully healed. I mean, this is like 9 months later, so I thought I was pretty healed. Oh, but it turned into the seroma basically in the same spot that it was originally.
Oh, I remember.
Came back.
Yeah. A year later.
Yeah.
1 year later.
Well, it came back in December, but no surgeons will see you. No plastic surgeons will see you till 12 months after your original surgery. And I wasn't going back to Dr.
Who?
Yeah.
We know who.
Yeah, no.
Doctor, we know who. Yeah. Oh my God, no, for sure.
So then I waited until March of the following year and then found Dr. Sun, who actually ended up doing a second surgery to actually remove that seroma because it had encapsulated as well. So we basically had to remove the whole thing and then do like he called it a quilt stitch, basically to stitch down that entire cavity where the fluid kept building up.
Wow. And then he did a scar revision too, right?
Yes.
Yeah, and it looks so much nicer.
Yeah. He did excellent job.
100%. That's why we love him. That's why we love Dr. Sohn. Now, On that note, dealing with the first surgeon and the first surgery, when you were going through all these complications, did you ever go in and try and talk to them about what was going on?
Yes. So, well, first, I'll tell you about the how they had people that were not trained massage therapists doing their lymphatic drain massage right after my surgery. So they were literally like pressing fluid out of my incisions in the office. These were,
That's right.
remember?
Oh my God, that's right.
These were the girls that were like working the front desk that were also doing like massage therapy.
Quote unquote.
Yeah.
And then pushing fluids out of your incisions. And mind you, she had a tummy tuck. Like, uh, oh my, and this is why, honestly, this is why you got a seroma.
Yeah.
Like every time I see patients that have fluid being pushed out of them, they always get seromas and then they always get fibrosis too. So then after that, what happened?
So when I started getting sick, I had contacted this doctor that night that I started getting the fever, and I said, I think this is related to the fat transfer to the breast. Like my breast is red, it's burnt, like it's hot. I have a fever. He's like, oh no, we're so far out from the surgery that can't be from the fat transfer. He's like, you need to go to urgent care. And he basically wouldn't help. So that's why I went the way I did and just dealt with it myself. He did not seem concerned. He didn't seem concerned about the seroma that I had originally either. He would drain it and I'm like, as it heals, oh yeah, it's good, you're good. It was basically very, it's fine, like you're done, like move on to his next patient.
Yeah, dismissive.
Yes.
Oh my gosh. And now from what I've seen, especially with how big your seroma was, is that they need to be draining it like 3 times a week.
Oh, wow.
Yeah, 3 times a week and putting in like an excessive amount of compression on there for the body to reabsorb it. Because now after what happened with you and seeing other patients, I'm like, if this doesn't get drained in 3 months, it will encapsulate and then we're gonna have bigger problems later. You're gonna have to have it surgically removed. There is no reabsorbing it at that point.
Right. No, and that's what happened. That's exactly what happened.
Yeah. So thankfully now that your insurance got to cover your boob and everything, because normally insurance doesn't cover that stuff. So then when you had to get the seroma taken out, did you know that it was encapsulated?
No, no, Dr. Song told me that.
Wow. And how did you find him? What made you choose him?
Um, had heard, I knew another surgeon, not a plastic surgeon, but another surgeon that I had worked with, that highly recommended him for plastic surgery. He was like, I don't know if they were personal friends, but they knew each other. So he's the one who recommended Dr. Song. I went, and immediately when I met with him, he was caring, he took his time, he was apologizing for the other doctor who screwed this up and, was just very gracious and kind and said, I'm so sorry that this happened to you because you're basically now going to have another similar surgery as the tummy tuck. And then I also had to have drains put in again for that one. So then you're living with the drains for a couple of weeks again. So now we're on our third set of dreams. Yeah, we're out this year process. So yeah.
Wow. How long do you think this whole process took from the first surgery to having to go back in and having the second surgery?
It was almost to the day, a year. Cause I could go into Dr. Song and he got it scheduled pretty quick. So I think the first surgery was like March 23rd and then the second one was like March 23rd the following year. So
That's crazy.
yeah.
What was the downtime on the capsule removal and then the scar revision?
It was, well, 2 weeks of having the drains in and then, 6 weeks before I could do any, resume regular activities.
Okay.
So it wasn't too bad.
And how did you feel after all that was finally out of you?
Good. Dr. Song sent me pictures, so I got to see. I think I sent them to you.
Yeah, I was like, send them to me. I want to see. I want to see how it was, and it's huge.
It was like, dude,
It's big.
It
the
looked like an
capsule.
organ.
It looked like an organ, literally inside you. And I couldn't believe it. I was like, oh my God. And it literally stemmed from your lower belly all the way up to here, huh?
Yeah, it was like almost like L shape.
Yeah, that's crazy. And so, how are you feeling now? And how long, like, how many years post-op are you now?
That second surgery was 2024, so we're about a year, 18 months now. And from that one, so I'm like, I think I'm fully recovered, I hope.
Yeah, yes,
Um,
yes. Do you think
but
you want to have surgery again? Like any
uh,
surgery?
you know what? I think I would, but I think I would do a lot more. Like I did research, but I don't think I fully did like talking to people like you that work with patients all the time. Yeah. Like I have another friend that actually utilized a company that's almost like recommends different surgeons depending on your needs. Like different people that are in the industry that actually, know and talk to multiple patients, I think I would get a little bit more insight that way. Like going on Yelp, like they can incentivize people to do Yelp reviews, it's not, and I think
I've seen those. I've seen those.
like, oh, you get free Botox if you give us a something like that. It's just, it's not what I went through was horrible. And it was like a horrible year of just going through things. Now that I'm on the other side of it, I'm super happy with the results. Like, I'm glad I did it. But I don't think it was worth all that to get to where I am now. So I would definitely do a little more talking to people that are kind of in the industry and know people, because I think that's where I got the best advice, like finding Dr. Sun was a recommendation from another doctor.
Yeah. And that's why I love him. That's why I only really like to work with him in Vegas. Because every patient that I get from him just can't stop raving about him. His bedside manner, his staff, the way that he communicates with you after the surgery, and the results that I see. Like he's a great surgeon as his character, but also his work. His work is really good. Your incision looks great
It does.
compared to the first surgery. So with the first surgeon, um, how was his bedside manner?
I basically felt like, I was a number, and he was just cranking patients out as fast as he could. There was no like, the aftercare was not great. Like, in the beginning, when they're trying to entice you to come to them. Yeah, they're really turning on the charm, but then after that, it's like, when I really needed him, when I was sick, like, he didn't want anything to do with it, and then he basically their office never responded at all after that. Yeah, which is crazy. But I was also not going back to them. Like, if they would have said, like, oh, you want to come? Like, I don't trust you now. You lost my trust, and I'm not ever going.
Yeah, never touch me again.
No, and I'll tell all my friends that are going to have surgery, like, do not go to this guy. Yeah, do not go to this guy. He is terrible.
Yes, yes. And after seeing you and a few other people, I'm also like, I would never recommend going in that direction. When you went in, did he ever check, like, see you for your boob?
Yes.
And so what was that experience when he did see you for with your boob?
So before I started getting sick, when he was still draining the serama, yeah, I had gone in and something, it didn't feel right. It felt like a hard calcification or something was hard inside my breast. So I would, I would told him, can you look at this? And he's like, oh, what size implants did I put in? And I was like, I didn't get implants. This is a fat transfer. Like, that was like a red flag, like, but it was, like, too late.
I can see your face line. Yeah, I can see him. Like, and you're talking to him, what? Like, like I know when you told me that, I was even like, what?
I hope that's in my folder.
No, like, you didn't put no implants in me. At least I hope I paid for the fat transfer, not the implant.
And I'm like, do I have implants? I hope. I'm, like, touching my breast. I hope. I don't think that's an implant. But yeah, he literally didn't even know that, which is crazy.
That is so crazy. But you know what? I'm glad after 1 year later, everything is healed now. And how does it feel to exercise now? Because I know you love exercising.
Great. I feel so good. I feel like my body finally matches like all the work that I'm putting into working out at the gym, and it's great. It was hell to get here, but now that I'm here, yeah, I'm super
It
happy.
was worth it.
It was.
Yeah.
It was.
Did you have diastasis recti?
I did. Yes.
Wow. And wow. So that's why you decided to get like the mommy makeover and stuff, right?
Yeah, it was that, and then I just had an excessive amount of like saggy skin on my my lower. Yeah. It was I had a over 9 pound baby, so
Oh my God,
he
the
kind
whopper.
yeah, he was a big one.
Yes. Awesome. Well, on that note, let's start some rapid fire questions. Okay, so question number 1. How much did your procedures cost you? Both.
First one, yeah, was about $30,000. And the second one,
30,000?
yes. Yes. That was for all those things together, which is the tummy tuck, the 360 lipo, the fat transfer, and the COT laser. The second one was around 8, and that was the Dr. Sun doing the revision.
Yeah, I'm fixing. Wow, beautiful. And for question number 2, what was your experience with the CO2 laser?
Also not good. I know this is shocking. Uh,
I know. After all the other not good things, of course, the face also.
I think lasers, like you have to be highly trained in lasers, and my skin type is it's a little bit olive, and I think with the CO2 laser, because I was under anesthesia when it was done, that the doctor went really hard. Yeah, and basically it took me having after it didn't heal, it scabbed, there was like discoloration. Um, I ended up having to go to a dermatologist and get like creams and things to help with the discoloration because it basically like left scarring on my face. Oh, so, and that took at least 6 months to, yeah, and that's your face, yes. So, yeah.
Did you have to pay out of pocket for the dermatologist too?
Yes.
How much was that?
Oh, multiple visits. If I had to guess, maybe $500, and then I had to get compounded prescription, so another 300 on top of that. So,
Oh my God. So maybe like 10K to fix the 30K mistake.
yes. Yes.
Girl.
It's expensive.
Yeah. Especially when they mess up everything at this point, right?
Yeah.
Wow. And so for question number 3, how did this affect you emotionally?
I think during that year I was going through it, I was so depressed and frustrated. Like I was not in a good place. Like it was very irritating. And then you overcome one thing and then something else happens. And then just be recovering from surgery alone is hard because you're used to go, go, go and used to being independent and doing stuff. And it's already a hard thing to go through. Yeah. So then on top of that, having to continually miss work or not be able to go out and do things as you normally would, miss my kids, sports games and things like that. Like it was a hard year. It was definitely, I think I went into a bit of depression and things from that, but doing better now. So,
Oh, 100%, girl. And I see it. You're looking amazing. Thankfully, everything's going in the great direction as it should be. As it should be.
yeah.
And thank you so much for coming on the show. I really appreciate it. And one last question that I ask everybody who comes on the show. Do you have any advice to give to anybody who wants to have plastic surgery? What advice would you give them?
Make sure you're doing more than just looking at Yelp reviews, that you're really doing your research on these doctors, if they've had lawsuits before, asking other people in the industry, like yourself, what other, anybody else that's done it, I would take their feedback to heart if you know of anybody that's had surgery. Since that surgery, I've had multiple friends have surgeries. I think you're saying half of them right now.
Oh, yeah. But I'm the honorary post-surgery therapist for all the homies. Literally.
So yeah, I would just make sure you do your research and you really, really, really look into it. I mean, it's a serious thing. It's expensive. It takes a lot of recovery time. It's a big deal, but in the end, I think if you go to the right person, I think it's totally worth that. Like, I kind of wish I didn't wait as long as I did to get it done. Oh, really? Yeah.
Aw. No, I totally feel you, but you know, everything happens, and I don't want to say like everything happens for a reason because it sucks. But you know what? I'm glad that you got through it, and being someone who was on the outside just facilitating you with the massages and everything and guidance, you made it look so easy. Like I couldn't tell that you were going through depression and everything. So you had such a good head on your shoulder, even though I know you went through something so hard for 1 year and then some because you had to recover from Dr. Sone's
Yes.
surgery. So and just dealing with everything. So you are a gold star patient. So I'm glad that everything's good. I'm glad everything's good. Thank you so much for coming on the show.
Of course.
And
Thanks for
sharing your
having me.
story. I really wanted you to share your story because what you went through was so crazy. And I hope that people, when they watch this, they can learn from this and really look at the doctors that you're going to. And even if you walk in and it's all glitz and glam, do your research. Do your research because what if when they're done with you, then they just stop talking to you and they just don't care about you and they just push you to the side, you know? You want a surgeon who's going to make you feel like family, you know?
Exactly.
Exactly. And on that note, like, share, subscribe, hit the push notifications for all things plastic surgery. Bye.